Hi everybody, welcome back to the channel. So as we talked about in the last video, there's just so much to talk about as far as healthcare goes in Southeast Asia, comparing it to Canada and the US. One of the key terms that I learned about through this discovery was medical tourism. So this week we are going to talk about a lot of the things we don't necessarily consider when we're thinking healthcare, and we think emergencies, we think doctor's appointments, prescriptions, but dental, vision, paramedical services are just important. And then especially for U.S. veterans like myself, there's a lot to be said about Southeast Asia. So we're going to get into that here in this video. Stay tuned. I just want to jump in here quick. I am still looking to connect with any existing expats in Southeast Asia. So if you're watching this and you would like to help myself and other potential expats learn from your experiences, share your story with us, I'm going to put my email, here's my email, and I'm going to put it in the description and pin it to the comments of this video. Let's connect and set up a time to chat. I would really appreciate it. Thank you.
Start with dental care. One of the biggest eye-openers for anyone comparing life abroad. In Canada, dental care isn't included in the national healthcare system. Unless you qualify as low income or receive social assistance, you pay out of pocket or through private insurance.
The cost of healthcare in the West, even in supplementary care in Canada, has steadily been going up over time. And in Canada, there's becoming a shortage of providers between the socialized health system where government regulates the salaries and the amount of patients and things like that, and access is becoming more and more limited because of the increased immigration over the last few years.
In the US, dental coverage is usually tied to employment, part of those workplace benefit packages that keep you locked in that work to survive cycle. Even then, insurance often only covers a portion of major procedures. That means many people delay treatment, not because they want to, but because they can't afford it. In Southeast Asia, that equation flips completely. Private dental clinics offer high-quality care for a fraction of Western prices, often 70 to 80% less, and most operate like boutique studios with modern equipment and internationally trained dentists. Countries like Thailand and the Philippines are well known for dental tourism, where people fly in for implants or full restorations and still spend less than they would back home. Routine cleanings cost around $30 to $50, fillings about $40 to $60, and even implants can be $1,000 to $1,500 compared to $4,000 or more in North America. The key is to choose reputable clinics, look for accreditation, transparent pricing, and solid patient reviews. For expats, this kind of affordability changes everything. You stop thinking of healthcare as a crisis expense and start treating it as regular maintenance. Eye care follows the same pattern. Eye exams are available almost anywhere, often same day, for around $10, $20. Prescription glasses and lenses can be half the price of what you'd pay in Canada or the US. Walk in, get your eyes tested, pick your frames, and walk out a few hours later. No referral, no waiting. When it comes to physiotherapy, chiropractic, and alternative medicine, the same pattern continues. Physiotherapy sessions at private hospitals or clinics cost about $20 and $40. Chiropractic care is growing quickly, especially in cities with large expat populations like Bangkok, Kuala Lumpur, and Manila. Expect $40, $70 a session. Massage therapy and acupuncture are widely available and affordable, though the quality depends on the provider, so always choose licensed practitioners. What's different here is how accessible these services are. You don't need a doctor's referral, and you don't need to justify it to an insurance provider. You can just walk in and take care of yourself.
The costs don't even necessarily require insurance to be able to take care of a lot of preventative care. I'm a big believer in chiropractic care. I've got some back issues from the military, and so getting regular chiropractic care as a preventative maintenance for me is something that is really valuable. So these services abroad being available and so affordable are pretty amazing.
Now let's talk about insurance, because this is where the freedom really shows. In the West, health insurance is often tied to employment. You lose your job, you lose your coverage. That's part of that work-to-survive mentality we've built into the system. Your health depends on your paycheck. Private insurance in Canada and the US can be shockingly expensive, especially if you're self-employed or semi-retired. Abroad, it's completely different. Expat health insurance is far more affordable and flexible. One of the best-known providers is SafetyWing, which was built specifically for expats, remote workers, and long-term travelers. Their plans start around $45, $50 per month, depending on age and region, and cover hospital care, emergencies, and even medical evacuation. You can buy it month to month, pause it when you're home, and use it across multiple countries. For the price of what many North Americans pay just for dental insurance, you can have full international medical coverage that moves with you. The key is to look for 3 things: high coverage limits, medevac, and repatriation. Get those right, and you're protected almost anywhere. And for my fellow U.S. veterans, there's a special option you might not know about: the VA's Foreign Medical Program, or FMP. It covers service-connected conditions while you're living overseas, and there's even a U.S. Veterans Affairs outpatient clinic right here in Manila. It's the only full-service VA facility outside the United States offering general medical care, prescriptions, and coordination with your records back home. If you're a veteran considering a move to the Philippines or Southeast Asia, register with the Foreign Medical Program before you go, or check in at the Manila clinic once you arrive.
One thing that I've learned about the Veterans Foreign Medical Program, it can take up to 90 days to get registered. I didn't even know about this coming to Canada. So I've gone years without this, and I've just recently started the process for registering while I'm living in Canada, being able to use the Foreign Medical Program for my service-connected disabilities while in Canada or any other country. So this is a tremendous benefit, but it covers specifically service-connected disabilities or illnesses, injuries that are exacerbated or made or are supplementary to those service-connected disabilities. So thanks for tuning in. I appreciate you sticking along to the end of this video. If you appreciated this content or other content about should I stay, should I go, your own decision-making process, make sure you like and subscribe to this video. A lot of great things coming. I've got 3 expat interviews scheduled over the next couple of weeks, so those will be premiering throughout the journey. And here's a preview of my first interview.
Like the entire amount of money I spend on a monthly basis is less than my rent for my house in Colorado Springs, you know? And my quality of life is, 10 times better. I exited the matrix, I left. I was done.
So thanks for tuning in, and I will see you on the flip side.